Hello, this is Dr. Divakar Bhat, Senior Cardiothoracic Surgeon working at Aster RV Hospital, Bangalore. I would like to present one rare case which I have encountered in my last 25 years of experience. It was a foreign body inside the chest wall, or we can call it as foreign body. It was a bullet. This was a 21-year-old young boy from Yemen, youngster. I don't know how he landed up into our country because he went in fact to a pulmonologist because he had some sort of persistent cough and breathing problem. So when he did an X-ray, usually pulmonologists first thing they do is X-ray to identify the lung problems, and he saw a small foreign metallic object, foreign body inside his chest wall. So he discussed with me and he referred the case to me, asking whether I can help this young Yemeni guy. And he came to me, I saw the patient, and from outside nothing was seen. The skin was intact. He had a fracture of the upper, he sustained multiple gunshot injuries, and he had a fracture which was tackled by orthopedician in his country. But this was somehow they could not identify, and he was suffering from persistent pain, cough, breathing difficulty, probably little blood in the sputum, all those things. And he was really scared and he wanted to have a best of the possible treatment. That's why he must have landed up in Aster RV Hospital, and my pulmonologist identified and he referred to me. And so we subsequently subjected him for a CT chest because we wanted to know exactly. See, chest X-ray is a two-dimensional imaging, so it will just show metallic object, looks like a bullet which is lodged inside the chest wall, but depth one will not be able to tell. In the CT chest we will be able to tell exactly where it is, how far from the lungs, how far from the liver, how far from the diaphragm, all those things. So to our surprise, this bullet had entered his chest wall somewhere just above his nipple from the chest wall, but it had traversed in an oblique way and it had gone and lodged somewhere between the lung, liver and diaphragm. All three are important structures. So this would have been difficult to remove by anybody else other than the cardiothoracic surgeon, because as a cardiothoracic surgeon every day I deal with the heart, lung, diaphragm and underlying liver. So in a way this was challenging, and CT chest has really helped us to know exactly what we are dealing before going in. So being a young fellow, anesthesia was not a big challenge for him, but my anesthetist gave a good anesthesia and we just opened that area with the fluoroscopic control. We knew exactly where to open. So my incision was exactly the size of that metallic bullet. It was around maybe 3 centimeter into 2 centimeter bullet, and it was infected all around. Though the tract had completely healed, but where it is lodged, it was causing inflammation, and that would have probably caused persisting pain for this young boy. Though this planning was challenging, but surgical was not so. Probably our preparation was so good. I could put an incision using a fluoroscopic control. I knew exactly the depth of this bullet, and removal of the bullet was easy, and luckily there was probably 1 or 2 millimeter margin from with all the important structures, and liver didn't get injured, diaphragm was safe, lung was safe and heart was safe. And this boy made a remarkable recovery. Immediately after surgery he was asking for food, and it was difficult for us to provide a Yemeni food, but somehow we managed, and very next day he could go home because X-ray was showing no bullet in his chest, and he was so happy. And it was a pleasure to see a smile on his young boy.